The NECS Consultancy formed 7 years ago with the idea of creating an in-house management consultancy for the NHS, which has got the quality and capabilities of the big management consultant firms, but we're part of the NHS family.
NECS works across all levels of health and social care, from NHS England right through to our 42 integrated care boards, through to our provider care settings, acute, mental health and community, and also our charitable organisations.
The consultancy model is based on a regional approach that allows our consultants to work within the local area and really see the difference they're making to the area where they and their family live. Within that regional footprint, we join together and form that national team that gives us that extra capacity and skill set to deliver those big national programmes, that local feel but within a national model.
NECS Consultancy, we have 7 service lines which are based on the needs of the NHS, and all of those service lines we have teams of experts.
We enable us to be able to respond to whatever challenge the system might have.
We're very motivated by the impact that we can have for populations, for people, and the meaningful change that we can make in communities.
At NECS, people truly embrace the organisation values. We deliver projects with honesty and integrity.
We're very much about listening to our clients. We understand their problems, and then we're able to put together our thoughts on how those problems should be addressed through a consultancy approach.
The culture within consultancy is that really can-do, let's try something different attitude.
It's about helping our customers and clients. It's about having the patient at the centre of that. So I've been registered as a nurse for nearly 20 years. So even though I'm furthest removed from the patient in the whole of my career, I feel like I've been able to make the most amount of effective change. So it's important for us that when we finish a project with a client, what we've delivered is going to be sustainable, that they're going to be able to take that forward.
NECS is working currently with NHS England on the elective backlog recovery programme, and this is great because we're working with our local acute providers on the ground, delivering theatre optimisation and utilisation for our clients.
One of the best projects we have delivered in the last year is a demand and capacity analysis model for a large community hospital.
So I've been working with a large mental health and community provider in developing their strategic plan. Our feedback from the client's been amazing, and really that's what makes it worthwhile, that we're making a difference for people, that we deliver something that's really high quality, that meets what they needed, that solves the problem that they had. We see our clients within the NHS very much as colleagues, and I would say that that's why NECS Consultancy is so successful.
So our customer ownership model is unique, and what it does is it allows the organizations working with us to really have a say in how the organization is run.
Any surplus that we make is reinvested back into that customer ownership model, which means those funds go back into services and help support the NHS and make the NHS better.
We're really passionate about supporting the communities that we serve, leaving a mark, contributing to reducing health inequalities, creating job opportunities for the local people.
And the fantastic thing about working in the health industry, you can really get that golden thread going through, and you can see how the things that you're working on are going to improve the lives of people that you know and love.
So we are more than just a service. We are a caring service and a caring organization.